our second discussion in a row, and as all of us know, the first discussion was devoted to social protection system in South Caucasus region and the social security issues. And our online discussion took place in online regime because of COVID-19, as we know. And once again, I do hope that you are staying safe and healthy. And first of all, I would like to thank to the Caucasus Civil Initiative Center, which brought together like qualified researchers from the region, from the South Caucasus region, and devoted time to discuss such important issues as social reform, policies, and healthcare system. And our distinguished panelists assess the health policy system in their, like the countries they present, and they identified challenges and problems in terms of healthcare system. And they have also provided recommendations for the steps and actions. The project titled Confidence Building for Social Policy Reforms in the South Caucasus aim to build like confidence between the expert communities from Azerbaijan, Georgia, and Armenia. And I would like to thank Black Sea Trust for their financial support for this important project. And it gives me a great pleasure to introduce you Angela Parulova, the project coordinator. So please, Angela.
Fantastic, thanks for introduction. Good afternoon, dear participants, and welcome to our second online discussion series on the topic of healthcare system review in the South Caucasus region countries. The Caucasus Civil Initiative Center is glad to host you in our project Confidence Building for Social Policy Reforms in South Caucasus region. This project is unique because of its regional scale. We have involved here 8 researchers from 3 different nationalities, and it is and sharing their practices, recommendations, and views is really very important for us to develop our social policy programs in our countries. So looking forward to hear your presentations, and wish you a successful and productive discussion. Thank you. So Quanta, maybe we can start introducing our dear researchers to start the presentations. Hello?
Okay, thank you. Thank you, Angela. So I will quickly make some introduction to the topic, and I think for the first time in the history, a health crisis has shut down our entire global economy and policies, and our healthcare systems were not designed. It showed the importance of healthcare systems, and the situation led to a better understanding of the problem and the importance of strengthening the health system and repeatedly reorganize the service delivery and to respond these essential services. And I do hope that we will discuss and we will have interesting and important findings from our researchers. And may I introduce you our panelists, Mr. Alexander Rakviashvili, professor from the University of Georgia, and Tatevik Karapetyan, a PhD student and lecturer at the Chair of Social Work and Social Technologies from Yerevan State University, and Isa Aliyev, who currently deals with medical technology business in Germany. And as far as I know, he has huge experience in healthcare sector in his homeland. So our first speaker will be Tatevik Karapetyan from Armenia. And dear Tatevik, you can share the screen and present your presentation, and I would like to give you 8 to 10 minutes for your presentation and for your findings and recommendations. So please, the floor is yours.
Hello, but first of all, maybe to enable me to share the screen.
Sorry.
Okay. Good afternoon to everyone. At first, maybe I would like to thank the organizers for creating this platform. I think it is very helpful for us to exchange views and share our experiences from our countries, and think that this is a great initiative which needs to be continued also later. I will try to be as short as possible. Maybe to start from the point that in Armenia, the healthcare system is regarded one of the most persistent social institutions. But and this is mainly because of the traditions coming from the Soviet past. But at the same time, it drastically differs from the Soviet universal free of charge health system. And for now, we have a healthcare system with a decentralized governance, where the ministry and government play only a regulatory role, and main part of the hospitals are under subordination of regional and local governing bodies, and the privatization of healthcare, because a large number of the big hospitals for now are privatized. All these changes bring drastic transformations also for the funding mechanism and funding scheme of healthcare services. For now, we will then go to the figures, but for now it's worth to mention that more than 80% of healthcare services are being done by the direct expenses of citizens. And another challenge brought by these transformations was the flow of the qualified medical staff to the outside of the country, and also concentration of qualified medical staff in the capital city. I will bring some data regarding three main directions: health expenditures, health indicators, and availability of medical staff. First of all, I already mentioned the part of health expenditures, and this is one of the biggest challenges in the current system, the structure of funding, where the state expenditure during the last 5 years was not more than 15% of all the health expenditures. And this is challenging because the health expenditures in the overall consumer expenditures are the third line, and for now there is a evident inequality of healthcare services for the population from the poor deciles. Regarding the health and indicators, we should mention that life expectancy at birth in Armenia are 75.9, but based on the recommendations of WHO experts, in reality this number is lower for about 5 years, because in this data it is not counted the mortality rate of citizens who are living outside of the country. Armenia has made significant results in the case of infant mortality, and regarding early infant mortality and infant mortality under 5 years, we surpassed the SDG target indicators. But here the challenging is maternal mortality rate, because it is quite unstable starting from 2016. And it is because of the unequal distribution of human resources and medical infrastructure. For example, the pediatric resuscitation services are available only in 2 big cities. Regarding the availability of medical staff, I should mention that here also the inequality is evident, obvious, because if you will see for 10,000 inhabitants in Yerevan, doctors are approximately 60, but in Marsis they are no more than 22. It is also, the situation is the same also regarding the availability of medical departments. Only 7 of all available 69 different hospital departments are available in the whole country, and 40 of these services are available only in capital city. For now, I tried to bring together the challenges, findings, and priorities, because all these are interlinked with each other. The health system for now is undergoing structural reconstruction, but the situation with COVID-19 has really slowed down the developments. For now, the main priority is to enhance the primary healthcare system and to more optimize the narrow specialized and specialized services. We have, as I already mentioned, a big problem regarding the health expenditures and a burden of health expenditures on population. So another priority is connected with the introduction of universal health insurance system. But regarding this, we have only some discussions and no real steps in this direction. For now, it is based on the personal preferences of single persons and also employers. We have a really challenging situation regarding these non-communicable diseases, because here the challenge is related with the accessibility of health services. I will bring only one example, that the cancer cases, more than half of all the cancer cases are being diagnosed only at 3rd and 4th stages of disease. And for now, the government is trying to make more free of charge services for persons with non-communicable diseases. In this regard, during the last 2 years, we was introduced a free of charge surgical treatment for cancer cases, and also emergency free medical care for acute myocardial infarction and ischemic stroke, which are really very helpful for the whole population. We have really good results regarding the communicable diseases and immunization. In average, 95% of all children and more are involved in the state immunization programs. What we want here as a country, what are our priorities? It is to eradicate tuberculosis and HIV/AIDS by 2030. And in this regard, we want to have a more effective vaccination system, to develop our laboratory potential, and to have a better system of regulation of diseases, mainly through the digitization of healthcare system. For now, we also have a system which is called ARMED, and it gives availability to all the doctors to see the history of all patients. And another challenge is the case of qualified medical services. Here we speak both about the modernization of technologies and enhancement of local capacities of hospitals, and also the capacity building of staff. Based on the last evaluations, there is a need to modernize the current system of education to make it more research-based. And also here we need to prevent the flow of human resources from the Marsis to Yerevan and outside of the country. And in this regard, we have a system of mandatory appointment of specialists who have completed a clinical residency, but this system needs some improvements to be really helpful for all the whole system. Regarding the policy recommendations, like in this regard, we separated three main directions. First of all is the access to quality healthcare services. Especially we have here need to ensure equal geographical coverage of healthcare services and professional staff, and development, enhancement of healthcare infrastructures at local levels. And the second one is mainly connected with the prevention and early detection mechanism for non-communicable diseases, particularly from malignant neoplasm. And this really is connected directly with the lack of and inefficiency of the preventive and early detection services. Our primary healthcare system in this regard needs real enhancement, both by the knowledge and by the equipment. And the other direction, which is very important for us, is the preparation and continuing education for medical staff. As I already mentioned, we are in the process of reviewing and modernizing the current system to make it more to make it better and to make it with the new to create like possibilities for the students for the to get this to have a new national education standards, because before this only the education ministry was responsible for these standards, but for now we need the lack that the health ministry also needs to be involved in all these processes. And another question is regarding the licensure mechanism for all practicing doctors and nurses. We have no higher education for the nurses, but the current developments show that we need to do some steps also in this regard. So for now, we are more in the stage of new structural transformations and hope that in the upcoming years, we will have a better system which will be based on the real health needs of our population. Maybe this is all. If you will have any questions.
Thank you for your interesting findings and the whole presentation, and what we learned from the from your research and from the example of Armenia. There are both economic as well as social factors, and the high mortality is a huge problem, which connects to the lack of inefficiency of the early detection services, as you have mentioned. And you have the preparation and continuing education system of medical staff is needed. And I think if you have any question, your panelists and the attendees, if anyone has a question, I'm sure Ms. Karapetyan would be pleased to answer them.
Hi, maybe I have one question. You mentioned that the cancer's third and fourth stage is only diagnosed in your country, and this is free to cure, right? But what about the beginning stages of the cancer? How the government cares about this?
For now, the government tries, as I already mentioned, to enhance the primary healthcare system and to use their potential in detecting. But we more now working not with the symptoms, but also but more with the effects, what we have already, because it is really big problem which is connected also with the health behavior of the population. These higher rates, people in Armenia don't like very much to go to hospitals. They are going there if there is no any chance anymore. So here the government is working from one side in awareness raising and changing this behavior. From the other side, it is more working on the enhancement of primary healthcare system, like to enhance also the doctors who are in primary healthcare system and use their potential for detecting the diseases in early stages.
Okay, thank you so much.
Thank you.
Does anyone has questions?
I don't have questions, but I'll return to this presentation when I will talk about Georgia.
Okay. Okay, thank you. So let's continue. And I'm pleased to introduce you our second panelist, Isa Aliyev, who has like more than 10 years of experience in healthcare sector, and he took senior level management position in Azerbaijan healthcare sector reform project. So please, Mr. Aliyev, you can share your screen, I do hope.
Hello, everybody. Just a second. I am sharing my screen also.
And I will quickly remind you that you have 8 to 10 minutes for your presentation and findings, and also for recommendations.
Just a second. I just want to go to the home screen of Zoom. Unfortunately, I cannot. Yes, I think.
I think you are provided with technical function of screen sharing, yeah? Yeah, it's done, thank you.
Yes. Okay. So, hello everybody again, and thank you for your invitation to join this interesting project. And I'm very happy to present about the Azerbaijan health care system, and my presentation will mainly focus on the what are the key indicators of the current healthcare system, and what is expected to be changed in the coming years, because the current period in Azerbaijan is a very dynamic, and it is the stage of transformation the whole healthcare system, with the introduction of mandatory health insurance, with the distribution of healthcare providers among different players, and then we will see a completely different picture after a few years. Let me briefly discuss about the health system structure and health system architecture in Azerbaijan. As in all of our countries, the healthcare system is inherited from the Soviet period, and it is a kind of like a regulated and a centralized healthcare management, which is similar to Semashko system, which was called before Semashko system. The major players are the Ministry of Health, Ministry of Finance, Mandatory Health Insurance Agency, Public Union for Healthcare Providers Administration, and Parallel Health Services and Private Sector. So the Ministry of Health is the major regulatory body. They are producing all the documentation and the regulations. And the Ministry of Finance in Azerbaijan is the key body who finances the healthcare services currently. But the financial flows goes in different ways in Azerbaijan. I mean, the Ministry of Finance allocates money to the Ministry of Health, and the Ministry of Health finances services in the network under their direct supervision. And starting from 2016, Ministry of Finance also gives money to the Mandatory Health Insurance Agency, They are also financing their own network, and the other public hospitals in the regions are mainly financed through their local governments, which are not the municipalities but the executive powers. And we have newly established mandatory health insurance agency, which was in 2016, and they are providing regulatory and financing functions, a kind of mix. And under the mandatory health insurance agency, Azerbaijan government established Tatevik, which is responsible for the most of the public healthcare providers in the coming years. But starting from 2020, they are managing about 23 regions and all their networks as a delivery function of the healthcare services. I think you have the similar systems in Georgia and Armenia about the parallel health services, because we have for example, oil company or some railway company and the Ministry of Internal Affairs and some other ministries, they have own healthcare systems. They are parallel health services. And the private sector also is improving in the recent years, and the numbers is significantly increased, but the problem is that most of the private sector hospitals and clinics are mainly in Baku, because more population are there and the doctors are there and all the technology and everything. About the health insurance scheme, I would like to make more information. Currently, the financing mechanisms of the Azerbaijan health system is a kind of mixed, because mandatory health insurance agency is implemented, health insurance scheme is implemented in the pilot phase, and the financing mechanism is different there, and the general government financing mechanism is a kind of like inherited from the previous system, which is general tax-based. So all the taxes are collected and then allocated across the different sectors of economy, also health. And the planning, financial planning and management is mainly based on the input. So how many doctors are in the hospitals, how many beds, how many buildings, and so on. But as I mentioned before, Azerbaijan established agency in 2016, and the financing mechanisms is going to change, because the agency is financing the healthcare providers under their supervision based on the results, but not inputs. So how many patients are discharged from hospitals, how many patients are examined in outpatient services or PHCs or like this. And based on these ones, they are providing financing to the healthcare providers. And the system initially implemented as pilot in 2017, and then in 2018 the pilot region expanded, and from the 2020 it was supposed to expand the whole nation, but because of the corona crisis and some economic fluctuations, they decided to make this period in a step-by-step way. So this year also a kind of like bigger pilot. And the law is already approved for the health insurance scheme. And this is not, I mean, kind of like surprise. This is based on the general practice as we experienced in many other countries. The major sources of revenue will be from the 2021 will be the state budget. So the state will cover the costs of the unemployed children, some people who have this lower income, and also employees and employers will contribute to the health insurance agency. And we will also have some sin taxes for tobacco, alcohol, or these kinds of stuff. So there will be some taxes which will be collected then to the health insurance agency. And the people who are self-employed will pay fixed amount of annual contributions to the health insurance fund. So they already have the benefits package, which is comparatively wide, and it almost covers all the services. But there are some luxury services which are not included there, as in many healthcare systems. But very high cost services and the basic services are covered in the benefits package. And there is a provider-payer relationship in Azerbaijan. So the delivery of the services are provided by Tabib, and the financing will be done by a mandate. This is the structure of the health system. And I basically prepared my report based on some key indicators of health services, health system performance. And these are included life expectancy, maternal and child health, and mortality indicators. So life expectancy increased compared to 2000, in 2019. It is about 76 years. Maternal child health also improved, but there are still some problems with the achieving targets of SDGs and MDGs already finished. And the mortalities also decreased in Azerbaijan during these years. All the figures are indicated in the review report. And there are some also in the service delivery part, in the outpatient services. I compared the utilization of outpatient services to those of some advanced health systems, and I see that the outpatient services is very low, because maybe the people in Azerbaijan is using services in hospital level, in inpatient level, rather than outpatient and the primary care level. But the screenings are improved during this period, because Azerbaijan initiated about 13 targeted state programs, which covered tuberculosis, cancer, diabetes, renal failure, and these kinds of stuff. And particularly the medications are given free of charge to the people who are registered in these programs. So because of the free of charge services, more people are registered, and that's why screening is increased, and the numbers are also increased during this period. Inpatient services, still the hospital discharges remain low in Azerbaijan compared to CIS averages and the European averages. And because there is, I will show this diagram, and the resources, Azerbaijan average length of stay is still high, and the bed occupancy rate is still low. So as it is seen from this diagram, bed occupancy rate was about 30% in 2008, and then significantly increased in 2014 and in 2011. And but the average length of stay is still high at 12, which shows that hospital inpatient services face significant inefficiencies. In 2011, Azerbaijan started a national level project, which is called the National Master Planning of Healthcare Network and the Health System Optimization. And they decreased the number of beds in hospitals about 2 times. Because from the Soviet period, we had too many capacity, and the hospitals were inefficient, because they were utilized about 30%. But after the decrease of the number of beds, the utilization automatically increased. And in the recent years, because of the increasing admissions to hospitals, the utilization is increased, but still it is low at 70–60%. But in many countries, it is advanced healthcare systems, it's about 85%. Public healthcare services can be considered optimal, particularly in the case of immunizations. It's about 95%, as I think in our region it's also same. And the HIV/AIDS incidence increased, but not so much, because compared to EU and CIS averages, it's very low still. This might be because of the lower screenings. Workforce supply is about average if we compare to many other countries, but the distribution is inadequate because compared to the regions, distribution is more to the capital city, Baku. It's about 62% of the medical staff, particularly doctors, are located in Baku. But considering the fact that we have more people in Baku, it is natural that there are more doctors in the capital city. But in the other parts of the country, there is about 2 times, 3 times difference between Baku per 10,000 population. We have had some decrease in the number of nurses, which is a serious challenge in the coming years, because in the optimization period, we will need more nurses to provide services. Medical specialization is considered less competitive because the average salaries medical specialists are earning is about 2.5 times less than the economic average, and which makes medical specialization is less competitive. But with the introduction of the mandatory health insurance system, their average salaries almost increased 3 times, and some specialization 4 times, which gives opportunities for the coming years. After the health insurance scheme, their salaries will also be increased. During the period which is analyzed, total health expenditures increased, and also out-of-pocket payments also grew, and the total health expenditure increase was on account of out-of-pocket expenditures, as you see from this diagram. So the total health expenditure is about 2.9%, and the 2% of this one was, about 80% of this increase was on account of out-of-pocket expenditures. So the government expenditures on health still remains low, which is about 1% of total GDP. But compared Azerbaijan economy to some other countries, there is a kind of like abnormality that as most of the GDP is on account of oil production, and that's why the GDP is very high, and the public expenditures on health still remains inside this GDP. But in the nominal term, public expenditures was increased about 7 times from 2005 till 2020, but still this covers only about 30% of the total health expenditures. So based on these indicators,
we remind you the time that you have, like maximum 1 minute.
So, although some improvements, still there needs to be done reform initiatives to improve the life expectancy and the maternal and child health. Azerbaijan needs to strengthen PHC services to provide access to basic healthcare services and to achieve efficiency. Screening programs, I think, can be continued because there are some improvements in the numbers and the disease management. We have inefficiencies in inpatient services, and with the introduction of progressive financing mechanisms and the financial protection, this inefficiency can be prevented. And the competitiveness of medical professional should be an issue, because otherwise more people will go to other sectors of economy. And there is a chronic shortage of financing in the system, and with more revenue collection and risk pooling mechanisms, the mandatory health insurance system is a chance to increase the funding of the total healthcare system. So these are the key points of future actions, which I enumerated here. Thank you so much.
So thank you for presenting such interesting and I would say courageous and optimistic findings of your research. For instance, that screening and registration on disease, the number is improved. But the crucial for the Azerbaijan and as well as for Armenia and Georgia, I think that it's improving of social and economic situation, in general. So if you have any question to Ms. Aliyev, I think he would be pleased to answer the questions. Okay, and then we can continue. And I'm pleased to introduce you Mr. Alexander Rakviashvili, who is the professor at the University of Georgia. So please, Mr. Alexander, the floor is yours.
Yeah, thank you very much. Thank you for this opportunity to discuss with you healthcare systems in our region. Georgia, I guess, is a very interesting case because Georgian government has already implemented nearly all the possible healthcare models that it could have. So you can see, for example, we have different models, and there's main stages of development of our healthcare system. The best performance of healthcare was observed in late 2000s after a huge wave of privatization and deregulation. So in late 2000s, we were at the same stage where now is Armenia, and it's good for Armenia and not good for us. And I'll tell you why. And the problem is political incentives. You know, every politician wants to drive voters and offer something free and free healthcare, free education, free something else. And we have the same problem in 2013. Our healthcare was free after 2013, and government decided to implement a universal healthcare system, and it was good lesson in economics because you know, when something is free, the quantity of demand is increasing, and our government got huge budget deficit. But after that, the government decided to exclude some relatively rich group of people from the system, and decided to regulate prices in order to decrease its spending. But it's not the biggest problem. Budget deficit is problem, of course, but it is not the most important problem, because universal healthcare system, which was implemented in 2013, dramatically distorted incentives and decreased efficiency in healthcare. One example here is. Georgia has more doctors per capita compared with any OECD country or country in our region. But at the same time, Georgia has the least of nursing and midwife personnel per 1,000 people. So it is the result of our universal healthcare system, because in this system, treatment imitation is more profitable than treatment. So nurses in this situation are less demanded. So there were cases, for example, when clinics paid poor people for only staying at hospital and imitating that they are getting a treatment. so where something is free, and when government regulate prices, it is always problem. You know, when we have competitive system, how, for example, hospitals can know what direction is more profitable, is more demanded. More demand, if something is more demanded, it means that it's more profitable, and they can concentrate on this direction. But when government regulate prices, it is impossible to understand what is more profitable, and so it changes incentives, and the whole system works bad. So we got big problems. But everything, pandemic changed everything. But before pandemic started, experts and government representatives discussed more regulations as a response to existing problems. And the main topic was DRG system implementation. DRG is diagnosis related group system. It was implemented in the United States in 1983, and because the system has already been implemented in many countries, we have a lot of evidence that more regulation leads to decreasing inefficiency. So there are many problems which can which caused by the DRG system, and this problem are still unsolved. So there are some examples. For example, if doctor can choose between two patients, it will concentrate on more cost-efficient patient. For example, who is more cost efficient? If we have two similar patients, one older and one is younger, it is more profitable to treat younger one because there is less probability that he will get some additional disease. So that's why some group of patients won't get efficient treatment. Manipulation with DRG codes are observed very often. For example, in the United States government spends hundreds of $millions every year because doctors are manipulating with DRG codes. And the most problem of the DRG system is concentration on more profitable directions. I told you that when we have free and competitive system, it is easy to understand what our consumers, our patients want, what is demanded, because we should concentrate on more profitable directions. But when governments start regulations, it causes problems. For example, when our government decided to regulate price in cardiology, and if it is more profitable, we will get more doctors in this direction and less in another. So we can have surplus in one sphere and deficit in another. It is a problem, serious problem for many countries, starting from Taiwan and from European countries. So, and these problems are not solved yet. But anyway, Georgian healthcare is quite efficient because of big size of private property and period of rapid development during the late 2000s. So it is the period when with the fewest regulations. And it is the best period in our healthcare system. And that's why we observe positive tendencies in life expectancy, mortality, infant mortality rate. So Georgia has also good performance during this pandemic, coronavirus pandemic. However, the problem of overregulation still exists, and it is not a technical problem. It is not a problem of doctors. It's a political problem because it is very difficult to discuss to tell people that they should pay for their the treatment they get, and that private insurance company can finance this without government regulations. Sometimes if you want high quality treatment, it should be expensive. It can't be free, and many things which is very difficult to discuss when you have elections. We have elections this year, and so I'm not sure that we are able to discuss our healthcare system critically this year. But anyway, I think that we will get a chance to evaluate our healthcare system because we tried everything. We had centralized and decentralized systems. We have a mostly private system. Now we have some universal healthcare system with government regulation, and then there was only small period of time when it was good, and it will be maybe several years when the system was mainly private and the government was passive, and we didn't have many regulations. So I hope that our Armenian neighbors want to repeat our mistakes, and will save their mostly private system with this government regulations, because not only our experience, but experience of many countries in this world show that more regulation is the way to decrease efficiency. And I also have positive expectation about our country, but only after election will finish, because maybe next year we will be able to discuss it seriously, not this year. So this was my main idea. I was told that I have only 7 minutes, so I spoke fast, but I'll be glad to answer your questions if you have.
Okay. Okay, thank you. But you have used less than 6 minutes, so you had 8 minutes left.
I need more time, more than 7 minutes. So
then we can discuss and answer the question the audience have, and I will try to conclude the case of Georgia. Like Mr. Alexander mentioned, in a small period of time, Georgia tried everything, literally everything.
Yeah.
And we had centralized system, we have now universal system with some additional regulations. And so if you have any question to Mr. Alexander in terms of Georgian healthcare system, he will answer.
Thanks for the presentations. I just want to address to all presenters. As the COVID-19 is a world level challenge, how would you evaluate the programs and regulations that the government has made from your country? So maybe shortly you could discuss what did you like and what was the worst step ever they have made. So maybe you could make a small comment about this.
I can start. We have very passive government in Georgia, and I'm not sure that there are many professionals in our healthcare. If we are Ministry of Health, and it is good in general in this environment, because I made research in April, and the main problem with pandemic was observed there, where government tried to be very active, to treat everyone, and For example, in the case of Italy or New York, is the case when a government is trying to help everyone, but this virus is not dangerous for everyone. It is very dangerous for a particular group of people, and the best strategy is to help and protect this group of people and ignore everyone else. So that's why our government made a few tests and was very passive. And that's why I think that it is the main reason why we don't have any big problem in Georgia with this virus. It was very active, but it was in April and May, but it was imitation of the fight with virus. Mainly, and it was political activity, not activity in healthcare. So I think that it is a very strange situation with coronavirus, and the problem is that sometimes we see that sometimes it is much better when government is passive, and maybe our example can be useful for our neighbors.
Thank you. Yeah, exactly. I wanted to ask. So my first question would be, so like Angela asked about the pandemic situation, and I would like to ask to Ms. Karapetyan from Armenia, because of the ways and the difficult and complicated situation the Armenia went through this pandemic. What will be what about your own predictions? What will be the impact of COVID-19 pandemic on the healthcare system, like in the world?
Armenia, the strategy of Armenia was different from the Georgian case. Our government was very active starting from the beginning, and for the until the May we have very strict regulations, and it was really a lockdown. After May, the regulations become more mere. For now, we have still some regulations, but overall, the country is not slept. The country is working, the economy is in a way of working. Regarding the healthcare system, I would say that in our case, the healthcare system really was very flexible to be transformed better for this pandemic. And for now, even we have the highest number of cases in the region, we all the patients who need healthcare, they can access it. In this regard, I think it is a good indicator. And this was a very good lesson for all the healthcare system, and also regarding how we would do the other steps in the transformation. Because we started we were already in the transformation stage when the COVID-19 appeared. And for now, it is like a good lesson for the health system regulators to know how to transform the system, also to be ready for this kind of crises. In this stage, I think we are going, the numbers are starting to decreasing. So the situation is more or less regulated at this stage.
Thank you. Thank you for your answer. Now, if anyone has any question.
About Azerbaijan, I would like to say about COVID-19 processes. So at the beginning, Azerbaijan, I would not say that they were late in doing some preventive measures, in closing the borders and doing some actions, and that's why in the first stage of the pandemic, they were very good. Very few cases we registered, and but after some period, the government was a kind of like relaxed, and they opened most of the facilities. And from this period, there appeared huge increases, and about 10 times more than the first period. There were some technical problems at the first stage, which was experienced in most countries, like supply of reactives and supply enough number of tests. They were not able to test as many people as possible at the first to 17 and to 3. And the other opportunity they missed in Azerbaijan is the home care, because the Azerbaijani healthcare decision makers decided to put everybody with COVID-19 to hospitals. And after some period of time, they understood that it's not possible to put everybody in the hospital, because the hospitals do not have such capacity, and it should not be actually to have too much capacity. And after some period of time, they decided to provide some home care services. And since I don't live in Azerbaijan, I don't see the processes in live, but every day I review the news and talk to my family there. And now the situation is getting better because of the home care services already in place. And the patients who are ill are not like so complicated cases. But in the coming periods, in autumn or in winter, or if this situation continues, these the people who are ill, they might experience this disease in a more complicated way. But if this kind of trend continues, they can achieve lower figures. Now they could decrease the number from 600 to 300 something every day. So this is the situation now.
So thank you for your answer. So I will ask once again if anyone has any question regarding your topic on research. Okay, then thank you very much for your interesting talks and questions. And thanks again to the Caucasus Civil Initiative Center for implementing such an important project. And I would like to ask Angela if you want to say once again something to our attendees and participants.
Sure. First of all, I am also thankful to consideration what should be developed and what's not working so well. So our main idea is to show them the ways, and hopefully they will implement them later. Thank you.
And thank you. At the end, I would like to thank once again Black Sea Trust for supporting for their financial support to the project. And may I thank you, all of you, for your active participation. And I hope you enjoyed our discussion. So thank you so much.
Bye-bye.